Opioid use in Rhode Island and Massachusetts has been a problem for quite some time, but numbers from the CDC show that overdose deaths rose significantly during the pandemic. An addiction recovery specialist that I spoke to says that 2020 made things so much worse. He has important advice on how someone can get help.
And then just the alienation that everybody suffered, not to mention that we have a poison drug supply. I mean, fentanyl has really been a game changer, but because of COVID, a lot of folks will use it alone. You can't save yourself if you have an overdose.
Michael O'Neill, manager at Anchor Recovery Center in Providence, says COVID very much exacerbated a problem that was already out of control. There are several recovery centers throughout our area. The recovery center opened in 2010 and has multiple locations across Rhode Island. O'Neill says they have seen huge numbers of people recently who walk in for help. O'Neill says he knows himself how hard getting help can be. He was addicted to opioids, now many years in recovery.
But, as a whole, I'm a person in long-term recovery myself. It wasn't my first idea to go get help. I was going to try to really do everything I could do to try to manage it. When the world kind of falls in around you, then, some pressure came from outside. For me, it was courts, but, many people, family members pushed them in. But people are resistant. Honestly, when caught in addiction, it's just kind of an endless cycle. I'm going to quit tomorrow. That's my mantra. And I always think I'm going to be able to manage it and pull it off at the end. So, until I couldn't, I found myself incarcerated. I had a drug dealer one time that told me to go home.
And that's what he says brings most people in, hitting rock bottom. But he says that crucial first step is awareness.
First of all, you got to realize there's something wrong, right? And then once you admit that, then maybe that's something you could build on from there. Anybody who has to want to change it, ask questions that might spark some kind of doubt in their mind and try to, get them to change their perception a little bit. But we don't tell people you need to do this. We found that it's not really effective outside the judicial system. Just offer them the different resources and support along the way too,
He says after awareness, getting support is also crucial.
Support is somebody that's walked the same path. All the staff here are people with lived experience with substance use disorder, right? We're all in recovery. So when you tell me that, this is going on in your life, I get it. I understand, when you're complaining to me that, your mom leaves the room and she brings her pocketbook into the other room because she doesn't trust you.
Although they have group meetings, a 24-hour hotline, and a mobile outreach van, O'Neill says he knows some people aren't just going to walk into his office. Sometimes the help has to come to you, and you can choose to accept it.
We have recovery coaches that respond to every emergency room in the state, 24 hours a day, 7 days a week. They'll be there within 20 minutes. So, and when we just sit down on the side of the bed and say, I've overdosed in this place. I've been here. I'm an overdose survivor myself. And if they want some resources, then I will share. We'll share that with them. We'll try to connect them with treatment if they're interested.
He says once that help is accepted, his recovery center has a lot of resources to help people get started. O'Neill says the key is a combination of support, medical help, and mental help. O'Neill says there's also another resource for help available.
I would also say if you're in the city of Providence and you're suffering with any substance use crisis, go to a firehouse. Safe Stations is also supported by us. Every firehouse in the city of Providence, you can walk up and ring the bell. The firefighters there will treat you with dignity and care. Call us. We'll have 2 peers there, and they will take you to treatment. Treatment's available, and it works. And we're here to help.
O'Neill says another barrier to treatment is what people think that it costs, but he says his program doesn't cost anything, and there are plenty of other local programs that don't either. You can find a list of resources on our website right here, WPRI.com. I'm Courtney Carter, 12 News.